Senate Bill 57. And the clerk will read.
Senate Bill 57 by Senator Wiener and others, enacting to control substances.
Mr. Haney, you may open.
Thank you, Mr. Speaker. Members, I rise to present Senate Bill 57 on behalf of Senator Wiener. San Francisco, Los Angeles, and Oakland, the cities included in this bill, are in the midst of a terrible, horrific, escalating public health epidemic. In the last 2 years alone, over 1,500 people have died of opioid overdoses in San Francisco. That is nearly twice the number that died of COVID-19. Many have died in public, on our streets, parks, and benches. I have personally witnessed people die on the sidewalk in front of my apartment in the Tenderloin. These are people with families, friends, and loved ones, and futures needlessly cut short, lost forever to a death that was preventable. This drug overdose epidemic is devastating families, communities, and hurting our state's recovery. That's why this bill is so important. First and foremost, there is no doubt that it will save lives by stopping overdose deaths and keeping people alive. It does that by giving some of the areas most affected by the opioid crisis, San Francisco, LA City, LA County, and Oakland, the discretion to authorize overdose prevention programs known as safe consumption sites. To be clear, no city or county is required to establish an overdose program under this legislation. Instead, SB 57 only authorizes cities and counties to decide locally whether or not to participate in this pilot program. This is a local control bill, and each of the 4 participating jurisdictions have requested to be included in this legislation. Unanimous votes by LA County Board of Supervisors, the San Francisco Board of Supervisors, Oakland City County, and a 14-1 vote by the LA City Council. This is a proven intervention that works. Approximately 170 overdose prevention programs exist in over 14 countries, including now in other states. They've been rigorously researched and have been proven to make neighborhoods safe. Overdose prevention programs bring the opioid crisis and drug use off our streets and parks and out of people's doorsteps. They save lives by allowing people to use controlled substances under the supervision of staff trained to prevent and treat overdoses. These sites also stop the spread of HIV and hepatitis by having clean supplies on hand, and most importantly, provide testing to make sure that drugs that might be laced with deadly fentanyl that is killing people in our state are stopped. Staff on site can connect people with services, healthcare, and treatment to get people off drugs altogether. Healthcare organizations are supporting this bill because overdose prevention serves as a point of entry to get people suffering from addiction into detox and drug treatment and on the road to recovery. I know most of us would prefer that people just don't use drugs at all and they seek treatment. But addiction is an illness, and we have to reach people wherever and however we can with interventions, and we cannot help someone seek treatment when they are no longer breathing. Overdose prevention programs not only save lives, but they save taxpayer money as well. They reduce the burden on services like ambulances and emergency rooms that traditionally respond and are increasingly overwhelmed by overdoses. Studies have shown that criminal activity actually decreased rather than increased in the areas around overdose prevention programs. This bill also ensures that law enforcement and public health officials have a seat at the table, requiring a public hearing with input from law enforcement, public health, and general public in advance of authorization. This is also a pilot program. It sunsets in 6 years, and participating jurisdictions will be required to produce a peer-reviewed study analyzing the site's performance. This will save lives. People are using drugs currently. There is nothing about this that encourages drug use. If you look at the data, you look at our streets, we need to pursue much more aggressive health and medical interventions, safety interventions, and we cannot keep using the same tools and expecting a different result. Our cities are begging to be given the tools and the authority we need to confront this crisis at the local level with an epidemic that is killing our residents. There is tremendous urgency, and we are ready to act. Respectfully, we need this body to give us that authority. And with that, members, I respectfully ask for your aye vote.
Thank you, Mr. Haney. Mr. Bloom, you are recognized.
Thank you, Mr. Speaker. Members, we are faced with an epidemic of drug use on the streets of our state, plain and simple. And I want to thank the member from San Francisco, the 2 members from San Francisco, Senator and the Assembly member, who have brought this measure to us. Let me give you some of the sobering statistics here, because this bill came up a couple of years ago and didn't make it through. And I'm not saying because we didn't pass the bill, therefore these statistics occurred. But there has been a dramatic, I don't mean a little increase, a dramatic increase of deaths on our streets over just the past year. So in Los Angeles County, last year there was a 56% increase in death. That's 715 overdose deaths, people living on the streets. Many of these people expire right on the sidewalks, and that's the end of their lives. San Francisco, 331 deaths last year, twice as many as reported in any prior year. In Alameda County, in the city of Oakland, is one of the. I'm giving you statistics for areas that this bill would apply to, where the pilot project would apply to. The city of Oakland, where my son works as a paramedic firefighter, 809 deaths last year. 25% of those deaths were from overdose. The deaths that we are seeing are predominantly young people, Latino, and black people. Those are the individuals who are most at risk. We're talking about fentanyl, methamphetamine, heroin, highly addictive substances that are cheaply available on the streets. And yes, like the member said, we can talk all day about how we would really like people not to use drugs in the first place, of course. But we have a responsibility to reduce the harm that these folks are exposed to, who are in dire circumstances, who are already faced with circumstances that put them against the odds. And so I'm asking you to support this bill. I feel like we have to put the numbers up here on the floor so this bill doesn't get vetoed, so it gets implemented, so we can give this model a chance in California. As our colleague from San Francisco stated, this model is in place in many places around the world. New York City implemented it a year or two ago, and it's working. There are fewer deaths. So I respectfully, I implore you to vote aye on this very important harm reduction measure.
Thank you, Mr. Bloom. Ms. Perna-Horvath, you are recognized.
I want to thank my colleague from San Francisco for bringing this forward. I know we've had lots of conversations about this. I have my hesitations about it because I fall into that category as a mom who thinks, having these safe consumption sites actually encourages people to use drugs. But the reality is, as my colleague pointed out, people are using drugs. They're dying from drugs. And so if we don't do something different, and we don't at least let these cities who want local control to try this out, try it, then I don't think we're doing our job today. It is not something I would want for my jurisdictions, but these are 4 cities who've all said this is what they want. It has to be, once we pass this legislation, it has to go forward, and they have to reaffirm that this is what they want by their local jurisdiction. So, I think it's far be it from me in San Diego to say what San Francisco should and should not do. If you've been on the streets in San Francisco, you know it's very, very different than what happens in Encinitas, and I think we should give them a shot. Thank you.
Mr. Bryan, you are recognized.
Thank you, Mr. Speaker and colleagues. I rise in strong support of SB 57. People are dying on our streets, they're dying on our sidewalks, they're dying in our parks. Substance abuse is high in many communities, and this is an evidence-based model that has proven to work not just domestically, but in models around the world. More importantly, as my colleague from San Francisco mentioned, this is a local control measure. These are cities and counties that have opted in to the idea that they could pilot these. It doesn't force the state to do it. It doesn't mandate the state do anything. It just gives them the authority to do the thing that's right for the people on the ground in their communities. As someone who's seen substance abuse up close in my own family where we've had overdoses, it's shameful that California isn't leading this conversation. But with bills like this, we can lead this conversation. So I want to thank again my colleague from San Francisco for bringing this measure, and I respectfully ask your aye vote.
Thank you, Mr. Bryan. Ms. Friedman, you are recognized.
Thank you, Mr. Speaker and members. I want to thank my new colleague from San Francisco, not just for bringing this bill forward, but for the amount of work that he's put in trying to make people in this body understand the importance of this. Now, I'm a principal co-author of this bill, and I have been a co-author of several bills that have dealt with this subject over the last few years. So I'm somebody who already comes to the table with an opinion about this, but I know for a lot of you, it's been a struggle to understand why we should do something that seems, in some ways, to maybe feed into the problem we're trying to solve. Well, I want to tell you a little bit about people's evolving their feelings about this and their thoughts about this. I had a conversation about 3 weeks ago with one of the police chiefs in one of my cities. Now, this is a very conservative individual who's been in law enforcement for maybe 40, 50 years. He's an older gentleman. And there's a lot of things we do in California he doesn't like. He's very conservative, and he tells me all the time, you know, you guys did this, you did that, you know, and he's often on different sides of issues. And this bill came up, and this measure came up, and he looked at me and he said, you know, he said, I've kind of changed my mind about this one. He said, over the years, he said, I've come to realize that what we are doing has not worked and that it's time to try something different. He said, I can't tell you how many more parents I have had to go to in our community, in our suburban community, to tell them that their high school son or daughter has OD'd and is in the hospital or even worse. How many people he's found on the streets unresponsive because of overdoses, many of them accidental overdoses because of tainted drugs. He told me that he now understands that these are people, many of whom actually want to quit drugs, who need to be dealt with in a different way. That what's happening with these addictive drugs is not the same as somebody, for instance, who's robbing a bank. These are people in the throes of a medical condition, of addiction. And they need support and they need help. And that saving their lives is #1 priority because we care about public safety, everybody's public safety. Drug addicts' public safety, everybody's public safety. So saving their lives is important to him as a law enforcement officer, and this gives him the ability to help save lives. It also gives him the ability of getting people off the streets and into some kind of care, often to get the trust of medical professionals, of other people who can offer them addiction services, offer them other kinds of help to get them off the streets and maybe to get them into a path of wellness, to make sure that they themselves don't have other communicable diseases or other conditions that are going to impact them. Because again, for public safety, saving lives is paramount, everybody's lives. So I would say to you members, if your thinking at all can evolve on this issue, if you agree that what we're doing isn't working, that people are dying in higher and higher numbers, that we see more and more people in the throes of addiction, then maybe it's time to try something different. And here is something that is proven to work, proven in other places, to get people not only to save their lives immediately, but to get them medical care, to offer them substance abuse care, whatever kind of counseling they need. That's what we need. That's what my public expects. So I would implore you today to allow the cities that want to pilot this and try this to pilot it and try it. But to say no to anything that might save lives is really legislative malpractice as far as I'm concerned. With that, I would ask for an aye vote. Thank you.
Thank you, Ms. Friedman. Mr. Muratsuchi, you are recognized.
Thank you very much. I rise in opposition to SB 57, and let me tell you why. You know, I recognize that the drug crisis, the drug addiction crisis, can and should in many ways be addressed as a public health crisis. We need to provide more drug addiction treatment. And there's nothing in this bill that requires drug addiction treatment. Let me tell you, this is basically a reintroduction of a bill that then Assemblymember Susan Eggman introduced, AB 186 from the 2017-2018 session, which was vetoed by Governor Jerry Brown. Governor Brown's veto message is very powerful. It says, after great reflection, I conclude that the disadvantages of this bill far outweigh the possible benefits. Our paramount goal must be to reduce the use of illegal drugs and opioids that daily enslaves human beings and wreaks havoc in our communities. California has never had enough drug treatment programs and does not have enough now. He concludes, enabling illegal and destructive drug use will never work. The community must have the authority and the laws to require compassionate but effective and mandatory treatment. If we need to try something new, we need to not only increase funding for more drug treatment, drug addiction treatment programs so that we can get people off of their addictions, but also we need to restore the drug courts that were working prior to the reduction of the incentives and the penalties that effectively mandated drug addiction treatment. So I say, let's listen, let's heed the wisdom that is reflected in Governor Brown's veto message. I respectfully request a no vote.
Dr. Wood, you are recognized.
Thank you. Thank you, Mr. Speaker and members. I rise in support of this bill. And with all due respect to my colleague from Torrance, I think just trying to mandate treatment on people is really, really difficult. I think about this issue, and I think about the history of this issue and the original drug treatment facilities like this in Vancouver. And the statistics that I remember from the Eggman bill was this, that it takes time to get people's confidence to be able to get them to even be willing to think about the services that they might need. And it takes, what I remember from those conversations and in that bill is that about 30% of the people who come in and use these facilities for safe injection sites ultimately reach out for services. Now maybe that's not a huge number, but that's 30% more that are doing it now. And of those 30%, 80% of them are successful in getting the care they need and getting back reintegrated into society. And isn't that a positive outcome? So yeah, this isn't perfect, and we aren't doing things, we're doing things that simply aren't working. Once again, this is a pilot program. These are cities that want this, that want to opt in. And I'll tell you, the bill took a little longer to get here because there is reluctance on the federal government side to sanction this or agree to stand down. But now I believe that won't happen. I don't believe the federal government will intervene here, and I think it's worth a try. Even I think drug abuse has probably touched everyone in here's family at some point. At somebody in your extended family has had some substance abuse issues. If you haven't, consider yourself lucky. I know my family has. And I know that if this was an option available for someone in my family, and this was the only option that seemed like it might work, I'd sure as heck want to give it a chance. So I urge your support on this bill.
Thank you, Dr. Wood. Ms. Bonta, you are recognized.
Members, as I rise in strong support of SB 57, as a representative of Oakland, one of the subject cities of this pilot program. In Oakland, I get to have preschool teachers and elementary school teachers tell me one of the first things they have to do in the morning is rid themselves of the remnants of people drug abusing in front of their school sites. Our preschoolers are having to swipe away and walk over needles as they head into their classroom. The city of Oakland has spent years working on this and fighting for the ability to be able to provide yes, another tool, not the only tool, and we are falling short for sure in our ability to combat drug addiction and drug abuse in the state of California. But that we have a city who's made a decision to try to move forward with something that can just be one more solution that we can investigate, understand, and really get a sense of whether or not this is something that we will be able to do, I think is laudable. And I'm in full support of our city, who has worked with their public health officers to be able to put this forward as a pilot program to be able to address the incredible drug addiction program and substance abuse program that we have in our city. And with that, I respectfully request your aye vote.
Members, if you'd like to be recognized, please raise your microphones at this time. Ms. Davies, you're recognized.
Thank you, Mr. Chair. I can tell you for the last 12 years, I've been working with families that have lost their children to opioid addiction, fentanyl overdoses. And obviously, the numbers keep going up. In the last year, we've increased from 100,000 to 110,000 overdoses. About 80% of that is fentanyl. And I sit here and I listen to this, and we act as if there aren't any solutions. But we've had this conversation when we were talking about gun violence. And right now, majority of fentanyl, which is killing, one pill kills like that, is coming across our border, and we're doing nothing to stop that. There's one solution right there. Why don't we stop the flow coming from the border? Number two, we've got so many different educational groups, and the bottom line is we're not out there reaching out to these people. I can't believe doing something like this. We look at trying to bring this forward, and this isn't the way to do it. I mean, does that save someone that's an addict or alcoholic that we just go ahead and say, hey, come over to the bar? We don't want you drinking on the street. We've got to have good common sense solutions, and the solutions are there. We also have to make sure that our law enforcement has the tools. And this is the other one that no one really wants to talk about, is there's no punishment. Last week, 2 people were arrested with 1,000 bags of 150 fentanyl pills that could have easily killed over several million people. And guess what? They were let out. So if you really want to start doing something, common sense, we have got to have repercussions for those that are dealing. There is no repercussions. They don't care. They don't know. Maybe they do what's in this pill, but that doesn't matter. It takes about 5 cents to buy a pill of fentanyl. Again, one pill kills, and I'm watching families. I'm getting calls, especially from families that have young kids after COVID, sitting there being depressed, thinking they're going to Snapchat and getting something that's going to relax them. And guess what? There was fentanyl in it, and they died immediately. So when we start looking at this, we do have solutions out there, but nobody wants to do anything. So let's look at our borders, see what we can do, stop it from coming in, number one. We're always on the back end of something here, never in the front end. And so let's do something, and let's make sure that, you know what, if you get caught dealing this, you do time, because that's the only thing that's going to deter them. They're making money after money, and no one's doing anything. Why bother? And this is going to be our solution, or this is an opportunity. Why don't we try the common sense solutions first, then we'll go into this. I ask for a no.
Ms. Nguyen, you are recognized at your desk.
Thank you, Mr. Speaker. Before the COVID-19 pandemic imposed lockdowns, fentanyl use or consumption among Californians was already approaching alarming rates. According to the National Center for Drug Abuse Statistics, fentanyl responsible for over 42,000 overdose deaths in the 12 months leading up to May 2020. Since then, nationwide deaths from fentanyl skyrocketed, with counts ranging from 10 to hundreds of thousands. Data from the Centers for Disease Control and Prevention, CDC, has sadly shown that since 2020, fentanyl has been the leading cause of death in adults 18 to 45 nationally. The rising deaths of fentanyl victims leaves many people, including the families of victims, asking who should be held responsible. How should we show that we as a society would not tolerate one more person being sold or consuming fentanyl and dying in this state? How do we send the message that as parents, as friends, and neighbors as leaders that we will no longer stand by as this crisis continues. If you agree with what has been stated by my colleagues here today who are supporting this bill, then you should agree to support my bill, AB 1955, which would have aligned the punishment for the possession of fentanyl with intent to sell with the same punishment for cocaine and heroin, with the possession with the intent to sell. Guess what happened to my bill? It never made it through the committee. It died in a partisan vote. And the bill is only intended to go after the dealers who possesses fentanyl with the intent to sell. And that was it. We are facing a dangerous situation that will continue to spiral out of control until we take a serious stand against fentanyl in our communities and our state. On April 6, 2022, in Orange County, one gentleman was charged with possession of fentanyl that will be able to kill 4.7 million people. That's just a few months ago. Last week, on June 24th, 2022, another person was charged with possession of fentanyl that can kill 12 million people. So we can continue to support bills that allow for safe use that you're arguing right now. Why not also go after the drug dealers who are flooding our communities, our streets, my community, my county, and my residents with fentanyl that are killing tens and thousands and millions of people, not only in Orange County, but across the country? I respectfully ask for a no vote.
Mr. Seyarto, you are recognized.
Thank you, colleagues. I hope you will indulge me in this. I don't have a written comment. I didn't really plan on commenting. However, I do have a little bit of experience in this arena, trying to help people who are on drugs, trying to save them, and I've saved many people who have overdosed on the regular drugs that we used to deal with, the old opioids, the trusted heroin, and some of those type of drugs. And it's as easy as getting on scene, drawing up your Narcan on the way over there because you know that's what you're going on, getting out, giving them their Narcan. They wake up. They're at first a little bit mad at you because you wrecked their high. Then they get up and they wander off. And then 2 weeks later, you do it again. Same people, same thing. It was our form of enabling them to continue because we did not get to refer them to go into rehab. We would suggest it. We would give them the cards, but they would not do it. There is no safe way to inject drugs anymore. And drug injection sites send the signal that, you know what, we give up, we're going to help you manage your drug addiction. Well, what you're doing is you're enabling people to manage their drug addiction for this particular shot or this particular injection or that particular injection. And at the end of the day, you will find them dead somewhere out there because we did not get them to the right place to get treated. Our kids who are dying are not driving, hopefully, they're not driving to a safe injection site. Because of what they do, if they safely inject a drug that even if they said, hey, there's no fentanyl in this drug, you can go ahead and take it. They're going to walk up, walk around the block where they park their vehicle, and they're going to drive off. Now, I shouldn't care. I live over in Riverside County, right? Oakland, 600 miles away. This doesn't affect me, right? San Francisco doesn't affect me. Doesn't affect my constituents. LA doesn't affect my constituents in Riverside County. That's 60 miles away. But you know what? I have family members. My 2 daughters live in LA. I have a cousin who has 2 beautiful kids. They live in San Francisco. I don't want people who are high to get the idea that all they need to do is go to the safe injection site, do their injection, make sure it doesn't have fentanyl in it, wander off on heroin or God knows what else they want to shoot up, jump in their car, and then start driving through our streets. That makes those areas more concentrated and less safe for law-abiding citizens who don't do drugs, who are just walking their kids down the street. They get mowed down. We've had a couple of people in Murrieta although we're about the safest city in the country, 17th I believe it is, we've had people get mowed down by people that are high that are driving. So there is no controls over that with the safe injection site. Yes, somebody can show up, they can inject their drugs. If you're testing it, it won't be fentanyl, but they can OD on heroin, and you can give them their Narcan. They wake up, they throw up, they get up, they walk away. And they walk into the neighborhoods that are surrounding them, or they get into a car and drive off. It is not safe. There is no such thing as a safe injection site. You are helping no one. You are not helping the addicts. You are continuing the process. We can help the addicts. We really can. My colleague from Manhattan Beach, that's what he was talking about. That's what we need to do. We had a bill, another bill. It was a task force bill to deal with the new drugs. That got shot down. Every bill I know in public safety that had anything to do with fentanyl got shot down. We have some money in the budget for a fentanyl task force. Well, I have no idea what that's going to do, but I sure hope we do something that'll combat what's going on here. Because sending our kids the message that, hey, we're going to help you manage your drug addiction is not the answer.
30 seconds.
I won't take the rest of the time. I'll leave you 25 seconds. Thank you. Obviously, I'm urging a no vote on this. Thank you.
Thank you, Ms. Seyarto. Members, if you'd like to be recognized, please raise your microphones now. Mr. Villapudua, you're recognized.
Thank you, Mr. Speaker. I've been battling this policy since I came into office last year. My hometown of Stockton has been paying close attention to this because the addiction of overdose has been the top issue for us. Over the years, it has driven up our crime rates and, sadly, homeless population. So we're looking for strategies being successful implemented around the nation and the global to help guide our own approach for this. And unfortunately, we're seeing that this is not the answer. Vancouver enacted a safe injection site in 2003 trying to tackle this issue. That year, 190 people died of overdose. 18 years later, in 2021, Vancouver had over 2,000 deaths overdose. Vancouver experienced 3 of the largest Canadian provinces and have denied the existence and stopped the safe injection sites. And I got to add this, in which I was challenging myself to talk about this, because it was said here that we all know somebody or related to somebody. My brother died of overdose. And as much as, like, my mom and dad would say, help him, try to do something. And I did. I took him to programs. I took him even an hour away to San Francisco, and nothing helped. Right? I mean, even in my hometown, I brought him. And we're talking about making changes here. You know, that nothing works, or maybe this would work. This is not the answer. The answer is this, is that we as electeds always want to support programs in our district that are 30 days, 60 days. But guess what? Those are revolving doors. People are coming in and coming out. That is not working. We need to put programs that are going to be longer and add vocational to them, because it's not just the addiction. It's about when you get out, what's next? We kind of like let them loose. We don't hold their hand. And we need to do more of that. That's why we need to add vocational programs, to get them a job. That is the answer. It's not about going cold turkey. It's about helping and doing more. This has been a tough one for me because I'm seeing more. I applaud everyone that's got up today and spoke, because it is a problem. But it's just a revolving door. We need to do more. It was also said that it takes time to build confidence. I agree. It does take time to build confidence. And that's why I said our program's got to be longer, much longer. But this is not the answer. And because of that, I caution our use of this program, and I cannot be supportive today.
Thank you, Mr. Fiapudua. Mr. Nazarian.
Thank you, Mr. Speaker. Colleagues, I wasn't really planning to say anything, but given some of the negative comments I'm hearing, it's kind of interesting to me how we cite statistics when we want something to go a certain direction, but then we fail to recognize those same statistics when there are other things benefiting us that we need to take example from and emulate. So when we look at countries that make infrastructural investments, just like the infrastructure bank resolution we voted on a little while ago, we glorify that and we talk about how great it's going to do for us here. But then when we look to see that these same countries, Western European countries, Ukraine among one of them, by the way, which is a still developing country, have over combined 200 centers of these that have proven to work. And as the doctor said it a while ago from Clarksburg, this program has shown 80% effectiveness. And I'm sorry, but a lot of the approaches I'm hearing are the trite approaches from 30, 40 years ago that failed. So we need to move forward. We tried to move forward in 2015, and it didn't work, unfortunately. I only wonder, I very much respect my colleague from Torrance, but I just wonder if it had gone into effect, how many lives would have been saved in California? There's no data that suggests that or offers that. So what we've constantly tried the same thing over and over hasn't worked. And we have numbers that demonstrate to us this works. Let's take example from at least 14 other countries stretching around the globe and see if this works for us as well. I support SB 57. Thank you.
Thank you, Mr. Nazarian. And Mr. Kalra, you are recognized.
Thank you, Mr. Speaker and members. I want to thank our colleague from San Francisco as well as our colleague on the Senate side from San Francisco for once again pushing this forward. I spent 5.5 years of my career as a public defender in drug court, representing addicted, the severely addicted, many who would relapse, many who would be successful. And there's a reason why those that are experts in addiction medicine support this bill. There's a reason why doctors support this bill. The reason why is that it works. And right now, the suggestion that somehow this is going to lead to more people being injured, which is really ludicrous if you think about it, because the reality is people are dying right now. The number one thing that this bill does is save lives. Whether someone goes into treatment or not, absolutely want that. As the doctor said, 30% go into treatment that otherwise would not if these safe sites didn't exist. That's an incredible number. Some of you might think 30% doesn't sound like a lot. Trust me, as someone that worked for years in drug rehab court, 30% is an incredibly high number for those that are severely addicted enough that are right now injecting on the streets or in other places that are not safe that would be able to use these safe injection sites. And the reality is that we have examples, as mentioned, hundreds of examples of this working, And also as mentioned that there's not been a recorded death in one of these safe injection sites. So it is about saving, and this is about fact versus fiction. Fear versus facts. Once again, we're hearing the fear-mongering that led us to be the incarceration capital of the world without us actually dealing with the underlying problems that led us to have drugs on our streets and led us to having folks that get addicted off those drugs. We got to face, as mentioned by some, the public health aspect of it. And the number one goal in public health is to save lives. And that's what these injection sites do. So I'll implore my colleagues to not buy into the same fear tactics and terminology and the lexicon from the 80s and 90s during the failed war on drugs, and instead listen to the experts, follow the facts of what's actually happening around the world, and let these jurisdictions try it, the ones that are actually seeing people dying on their streets. Let them try it and let them come forward and say, these are the results from it. These are the folks going to treatment. These are the lives that otherwise would have died on the streets that we've saved. Respectfully ask for an aye vote.
Thank you, Ms. Kalra and Mr. Cooper.
Well, I can say this. There is no damn fear-mongering, first of all. It is what it is, and that's the big thing. And with Prop 47, drugs were reduced to misdemeanors. So there's, you look at your drug arrests, they're down. It's the misdemeanors, the same as breaking a window or doing a lawn job. So you have a lot of drugs out there, and drugs is the hardest thing to get off of. I spent 30 years in law enforcement. I'm going back now as a sheriff. But for 5 years, I was buying drugs undercover every night. And people would do anything for drugs. A lot of prostitution, a lot of sexual trafficking involve drugs. A lot of child abuse involves drugs lifestyles. A lot of domestic violence involves drugs. It is hard to get off of drugs. I don't care who you are. If you're homeless, you got no job, nothing, you're pretty much screwed. If you have a family and support system, it is tough, sometimes 2 and 3 times. Remember from Stockton, his brother died from an overdose. Drugs are so hard to get off of. And the reason this narrative came to light was because a lot of these suburban kids turned to heroin because of the opioid crisis, and then fentanyl. Fentanyl's cheap. It's $2 a pill. And one thing my colleague from San Francisco who's jocking the bill, they're going to come in and test their drugs. That's BS. That's not in the bill. That's not in the bill anywhere. So if you're a dope fiend or drug addicted, you're going to come in and have them test your drugs when you have only a minute amount anyways? No, not at all. My colleague from down south, the former fire chief, he's seen overdoses. It is crazy. You can't talk out of both sides of your mouth. I hear a lot of stats here how bad fentanyl is, the overdoses and stuff. There's no drug court right now. Drug court worked. You ask the DAs, you ask the judges, it worked because they had a hammer to force someone into treatment. That really did a good job. There's no drug court anymore. If someone goes to drug court, they want to get their record expunged. That's why they go to drug court. So there's really no reason to go anymore. Think about that. It is hard. So if you want, and fentanyl is so bad, this number of overdoses, well, if someone's selling fentanyl, they should get hammered, 100%, right? That's a big overdose problem. This body, I've seen no bills introduced. It can't get out of public safety. So if fentanyl is so bad, let's put the hammer down on folks. So many people have died from fentanyl overdose. We don't want to do that. We want to play nice. It's a public health crisis. You don't have enough treatment programs right now. Not enough right now. This problem's gotten worse. I can skin my knee and go to med clinic. I'm having a problem with addiction. Where do I go? There are not enough programs for the homeless right now. And if you have insurance, hopefully you get in. That's the real talk, seeing this. Nothing good happens because of drugs. Who wants to stick a needle in their arm? Fentanyl's cheaper than heroin. That's the fact. And if you bring it in there and you overdose, we're facilitating that. Or you bring it with your buddy. How are they going to test it? They're going to test that drug. And fentanyl is so dangerous right now, your public safety folks have overdosed on it numerous times. Little pinhead mount, they've overdosed. So this person, this civilian working in that market to come in and test it, you're going to test your drugs, I call BS on that. That's not happening. Drugs, like I said, a lot of bad things happen with drugs. and it's not okay. We're going to go ahead and do it. Vancouver was a failed experiment. Google it and find out. The rest of the Canadian provinces banned their programs because it didn't work. Really dig down deep, and you can get up here and just quote stats and stuff, but no, it doesn't happen. State public health officials note that deaths from synthetic opioids like fentanyl have increased 819% from 2017 till last year. In 2021, emergency room visits from the use of synthetic opioids increased 166% in just the first 3 quarters of 2021, and deaths increased by 153%. So if you're a drug addict, I'm going to go to the safe injection site to shoot up if I'm an IV drug user. No, that's not how it happens. You're a drug user, you go use that drug. You're not worried about that. And that's how it is. I've been down to San Francisco to that site, the little area, the little safe area, and having worked narcotics, I know what a dope dealer is. And I saw a lot of dope dealers around those houses, the apartment buildings that
30
these folks
seconds.
are in with that. And it really frustrates me because people just talk about inaccurate information. There's no quality control or testing. These narcotics are so dangerous, there's no difference if medical help is nearby. It sends a bad message to go ahead and do this. And where are these clinics at? Where are these safe injection sites at? In the hood. They're not in rich areas, they're in poor neighborhoods. And that's the bottom line, in poor neighborhoods. I don't see them in rich neighborhoods. And we wouldn't be here, like I said, if it wasn't for suburban kids getting it. It is a problem, it is a major problem. It is horrific. So if you want to fix it, punish the dealers. Get treatment for them. Treat it like a public health crisis. We have not done that. But don't condone it and make it worse. 30 years of being a cop, a lot of death, a lot of destruction. Nothing good happens because of drugs. I respectfully ask for your no vote on this item.
Mr. Rodriguez, you're recognized.
Thank you, member colleagues. I wasn't going to speak on this, but hearing the debate makes me want to say a few words about this because I see both sides. I hear one of my colleagues talked about the overdoses of heroin addicts. I agree. I've been on hundreds, if not thousands, of folks who have overdosed on heroin. And the fact that we go back to see them again later that day, later that week, we try to help them, educate them about the dangers of heroin and what it does, and it didn't really help. Talking about another aspect of it, my brother. I really don't talk a lot about my personal stuff. My brother was probably 30 to 40-year heroin drug addict. And after all that time, I can't tell you how many times I took him personally, let alone my parents, to these drug rehab centers for the week, 2 weeks, in some cases a month. Never helped him. And the fact that he come out, he may be clean for a day or two, and guess what? He's out there doing his thing, stealing, coming to my mom and dad's house, asking for $10, $5 to get his heroin fixed. And unfortunately, after all these years of trying to help him and advocate for this, it didn't help. Sad to say, about 2 years ago, he passed away because of all of that, the health issues. He came from over 30 years as a heroin drug addict. It took his kidneys, his liver, and unfortunately, he passed away. But to see all the struggles that he went through, and the many folks out there that we talk about seeing this bill that would help them, kind of goes back to another thing, just thinking about it right now. My daughter works at a Starbucks, and not even half a block from the Starbucks is a methadone center to help these heroin addicts, right? And what she tells me, Dad, they go there, they do their thing, and sometimes they come and use our restroom in Starbucks and cause more problems and havoc. And you see a lot of negativity in those areas that she experiences from a business just next door from one of these places. So I have a lot more to say, but I just want to speak a little bit about my personal experiences on dealing with these heroin drug addicts and the fact that we want to give them a location to now do it in a safe environment. Well, it's not really going to be safe. And yeah, we might save a life because maybe not this time they're not going to die, but look what it did to my brother. And also with that, my brother was saved by about 3 or 4 times because folks did have to call 911 and help him with his issue, but didn't do any good. 30 years later, he passed away because of all those years of what it did to his body. So I urge to not to support this bill because I don't think it's the right time at the right moment. There's a lot more that we need to be done, but we're not doing. But hopefully, it at least starts a discussion. Thank you.
Seeing no other members seeking recognition on the item, Mr. Haney, you may close.
Thank you, Mr. Speaker. I first just want to acknowledge and give my condolences to the member from Pomona and the member from Stockton, both of whom lost their brothers to this epidemic. And I want to appreciate you for sharing those stories. I know that's very difficult, and thank you for sharing that with us. This is a very personal, challenging issue. It's touched every member in here in one way or another. It's touched every part of our state. People are dying in every single district and region of California. And a lot of folks said things that I agreed with, even the people who said they were voting against the bill, that we need more drug courts, that we need more treatment, that we need to stop the supply. And you have my commitment to work with you and partner with you on all of those solutions. This is not the only solution. This is not the one thing that is going to stop the fentanyl or opioid epidemic in our state, but it will help. It will help, and it will save lives. We know it will save lives. There are hundreds of these sites all over the world, and there has not been a single death in an overdose prevention site in the world. These sites will save lives. And my colleague from Torrance who said that we want to get people into treatment, absolutely, absolutely. We want people to stop using drugs. We know this is dangerous, but we can't help somebody once they've stopped breathing. Once we lost them, they're gone. And we have to get them inside. This is not just a choice. This is not a choice that people are making. This is a medical condition. This is an illness. It's a disorder. People can't control the decisions that they're making. So if we can get them inside to a medical environment where we can intervene, where we can provide options to them, where we can make sure that they stay alive, that will help. And at the same time, for folks who are concerned about safety, my city, San Francisco, Oakland, LA, we're also doing this because we want to address public safety. We have people right now, as my colleague from Oakland said, who are using drugs out on the streets, needles spread through our parks and sidewalks. Our police and fire are begging us to say, let's have a place to take these folks so we can get this off of our streets. So this is a public safety intervention as well. And our cities have been begging for this. We are ready to act. Our communities, our neighborhoods are begging for it. And we need this body's help to give us that authority to try this pilot program in California. But we're not just trying something new. We're trying something that is proven all over the world. And with that, colleagues, thank you so much for your comments and your personal thoughts on this. This is something that I'm committed to working with you all for many years. This is one part of the solution, but it's a solution that we desperately need. With that, I respectfully ask for your aye vote.
And with that, the clerk will open the roll. All members vote.